If you could make one change to the healthcare system to benefit both patients and doctors, what would it be?
That's a very, very good question, and it doesn't have any easy answer because our political parties, both Republicans and Democrats, they tell you things what they're going to do to fix the problem, but they have not been able to do it so far. Our USA healthcare budget is $4.3 trillion dollars. Trillion with a T. That's a lot of money, okay? 1 trillion is 1,000 billion, if I understand. So, you can imagine, 1,000 billion times 4, okay? That's 4 trillion. We spend that much money on healthcare. Healthcare is one of the biggest three budgets. Healthcare, Social Security and defense. These are the three main money takers. But unfortunate thing is that in spite of spending so much money, the healthcare service, the health of the people in the United States is way lower than the other developed countries who spend much less money. So there is a problem. We are spending a lot of money, the most in the world, and getting the less value out of it. So there are many, many reasons why this is happening. One is the wastage. There's a lot of wastage. There's a lot of insurance companies who have, some of them big ones, they just care for their stockholders. They don't care about the health of the people as much as they are worried about making money. So somebody has to, all of them have to take responsibility. The insurance company, the government, the patients, and the doctors all have to take the responsibility of doing their best to take care of the patient. Patient has to take the responsibility also. You cannot just pretend that I'll go to doctor and I'll be healthy. You have to exercise. You have to have a healthy diet and be happy. Find ways to be happy.
So what would the single change that you recommend?
I would recommend that we should have a one-payer system. One-payer system is the system by one payer, like maybe government. And they should collaborate with the insurance companies. They should give them some responsibility, but the lead should be taken by one payer. As far as I know, that Medicare, for example, is a one-payer system. It has a lot of flaws, but it's a good system. It takes care of what it says. It takes care of the people who are on Medicare, our elderly people. It takes care of them more than the private insurance does. I was against it a few years ago, but what is going on right now? We need to have a system which is like a Medicare to cover about 30 million Americans who don't even have the insurance. And they cost a lot of money when they go to emergency room and at the last stage of their sickness, when where their sickness is complicated, they go to emergency room and get admitted. Who pays for that? We, the taxpayer, pay for it. It costs us more money. So the leadership has to sit down with collaboration of all the stakeholders and come up with a system like Medicare. What is good for the doctors? Doctors are not business people. They are trained to take care of the patient. They have a heart. They don't care about money as much as they take care about their patients. But they get the raw end of the deal. They are underpaid. The service and the hours they provide is much less the money a plumber or the mechanic makes. Doctor's training and education is about 12 years. Plumber and electrician or the mechanic, you can become expert in 2 to 3 years, okay, or less. So doctors are getting raw end of the deal, and doctors are not allowed to have a union. there's a Stark law which prohibits doctors, private practicing doctors to make a union. So, and the doctor, unfortunately, they don't get together. They don't see eye to eye from each other. They take care of the patients, but they don't want to take care of themselves. They hardly make demand. They're too busy taking care of the patient with their lives. They don't have time to make a noise. But I think it's time for the doctors to take your life in your own hand and make demand. Talk to the politicians, talk to the patients, educate them what is going on right now, so that patient can get a better service directly from their own doctor rather than getting from insurance run medical factories. Thank you very much.